In a radical neck dissection, why is the lower end of the internal jugular vein ligated before the upper end? Options are A. To avoid accidental injury to vagus nerve. B. To facilitate easier access to the carotid sheath. C. To prevent tumor cell embolization and air embolism. And D. To reduce lymphatic drainage from the thoracic duct. Answer of this question is to prevent tumor cell embolization and air embolism. Reasons for ligation of lower end. First is prevent tumor cell embolization. If upper end is ligated first, blood flow from the lower end IGV can force tumor cell toward the thorax, increasing the risk of tumor emboli entering into the systemic circulation, mainly in the lungs. Second cause is to avoid air embolism. The upper end of IGV is closer to the negative pressure of thoracic inlet and subclavian vein. Ligation of lower end first minimize the chance of air being sucked into the thorax, especially into the inspiration, which lead to the venous air embolism. Third reason is control blood loss. By securing the lower end first, outflow from the head and neck is reduced, helping controlling the bleeding in tributaries during dissection. Fourth reason is oncological principles. Radical neck dissection allows oncological safety protocols and preventing potential hematogenous spread of the cancer is priority and this technique support it.